But in fact, your body adapts quite easily to the cholesterol that you get in your diet from something like an egg or a shellfish.
But look for cholesterol in food, and another familiar villain is rarely far away.
Here's what happens. Cholesterol is only in animal foods, and animal products typically come with saturated fat in them. And saturated fat has also been vilified for years. And so there was a public health movement to get cholesterol and saturated fat out of our diets.
Saturated fat raises LDL, the so-called bad cholesterol, that can collect in our arteries and cause heart disease. But it also increases HDL, the good cholesterol that helps clear out the bad. Ultimately, the war on fat was undiscriminating and had unintended consequences.
It also led to an obesity epidemic. And you can't pin the obesity epidemic on any one thing. But there's certainly a lot of us that believe that it was the interpretation of the food pyramid that led to a trend of more calories.
The food pyramid was a campaign launched in the 90s to promote healthy diet choices. The base was grains, then fruit and vegetables, then dairy, then meat and fish, and then sugar, and virtually no fat.
And what we really got out of it was a lot of bread, a lot of processed, refined bread, because grains were low in fat. And so that has confounded everything that the original investigators had intended, because vegetables are low fat, beans and legumes are low fat, fruits are low fat, and that's not what people were picking.
What people were picking were highly processed foods and refined carbohydrates, which actually lower HDL, the good cholesterol. They also led to obesity, diabetes, and high blood pressure, all heart risk factors. The low-fat diet experiment had big problems, and Gardner argues we could be missing an even bigger picture.
There's 20 other things that affect heart disease, but at the end of the day, there's a lot of people with high LDL cholesterol who don't get a heart attack. And there are plenty of people who have low LDL cholesterol who get a heart attack. There seems to be a misunderstanding about the proportion of risk that's attributable just to LDL cholesterol. It's really been exaggerated. I think it's partly driven by the fact that there's a lot of money there.
Money. In any investigation, you always follow the money. In this case, Gardner's referring to the billions spent annually on statins. First introduced in 1987, statins currently lower LDL cholesterol numbers in the blood more effectively than diet or any other method. They have become the biggest selling and most popular prescription drugs of all time, and the sales continue to rise.
After the most recent statin guidelines came out from the American Heart Association, it was estimated that if these guidelines were followed, about 1 billion people worldwide would be prescribed statins.
Could 1 billion users be wrong? Are statins the answer to the cholesterol question? The prime suspect in the heart disease crime wave continues to be cholesterol. Aaron Holmes' doctor told him his cholesterol numbers were dangerously high. He was in his 20s then, and he's been on the run ever since.
A doctor told me at one point, if you don't take medication, if you don't get your cholesterol level down, you're going to be dead before you're 40. And so I never allowed myself to think beyond that age. And as that age became closer, and as I had kids, I started to realize that I actually really wanted to be, around, and I really wanted them to have a father. And when I turned 40, it was like the epic moment where the sun comes out and the choir sings, and you're like, holy cow, like I didn't die, and so all of a sudden the future was this thing that opened up, and I had never thought about it. I might develop a relationship with a doctor now and just be candid and say, look, I don't want to take medication, and I'd like it if you were to come up with some alternate ideas around how it is that I can manage this if it is in fact a problem. I just don't know how many doctors are able to have that conversation, because most of them can't seem to get past the notion of medicating.
The medication Aaron wants to avoid is a group of drugs called statins. A tall order, because statins are the most widely prescribed drugs in the world. He's come to see Dr. Beth Abramson, the author of Heart Health for Canadians.
And in terms of risks for future heart disease, we're just going to go over a few of these. You've never been told you have high blood pressure?
No.
No history of diabetes?
No.
You're a smoker?
No.
Shake your hand.
Thank you.
All right, so you're feeling well, but you're a young dad and want to make sure your future risk is okay. Is that right? Okay. Well, I'm going to have a listen to your heart and lungs. When we calculate someone's future risk for heart disease, cholesterol is an important aspect. It's not the only aspect. A patient is not just a cholesterol value. So if you have diabetes, you're smoking, your blood pressure is high, your risk is going to be even higher. So every one of my patients that I see who's come into the hospital with a heart attack, or who's been diagnosed with coronary heart disease, or who's had a stroke, I know their chances of dying or having a recurrent heart attack are lower on the class of cholesterol pills called statins.
There are a number of statins.
Getting to goal is important, especially if you have high cholesterol, plus any of these risk factors.
Many of us have seen the ads, some aimed at our deep fear of heart attacks, or playing into our desire for easy solutions by equating a pill with a vigorous swim or bike ride. Statins all work by inhibiting cholesterol production in the liver. In randomized trials, they are the only cholesterol medications that have been shown to reduce risk in people with known heart disease. But debate has been raging. Have they been overprescribed? Dr. Barbara Roberts is the author of The Truth About Statins.
Almost without exception, these trials have been paid for by the pharmaceutical company that makes the statin being studied. And we know that industry-sponsored trials are 4 times more likely to report a positive result than non-industry sponsored trials.
As for statins' role in preventing heart disease,
if you're giving statins to healthy but high-risk people, healthy people who haven't had a heart attack, the absolute risk reduction in 3 of the biggest primary prevention trials in men is on the order of 1.5%. Even the most fervent statin apologist has to admit that anywhere from 60 to 80% of cardiac events are not prevented by statins. So if you had a vaccine, for example, that didn't prevent 60 to 80% of cases of flu, how many people do you think would use that vaccine? Very few.
Take a deep breath in.
Dr. Abramson believes that statins do have a role in primary prevention, along with other therapies.
In patients who have not yet had a problem, there is a role for cholesterol-lowering pills. It doesn't mean we put it in the drinking water, and it doesn't mean that we use a statin for a substitute for making lifestyle changes.
But would there be any harm in taking statins just in case?
This gets us to the whole area which gets me upset, and that is that the benefits have been vastly exaggerated and the dangers have been vastly underplayed. The only group where we know there is some benefit is middle-aged men who've had a heart attack. In fact, in the older age group, higher levels of cholesterol correlate with better survival. Elevations in cholesterol are only a risk factor until about middle age.
Dr. Roberts says there are also questions about benefits for women.
I think that the reason that women have less benefit from statins, if they have any benefit at all, which is questionable, is because LDL is not a significant risk factor in women. The other thing is that women are more apt to have side effects to statins. We know that women are more apt to have muscle pain and muscle damage. Women are more apt to develop diabetes as a result of statins. There are multiple side effects, and I really worry about the long-term effect on the nervous system of treating people and getting their cholesterols down to very low levels.
Most doctors argue the benefits of reducing risk outweigh the potential side effects in both men and women.
There are a small percentage of my patients who will have a side effect on a statin or cholesterol pill. That often will manifest as either an ache in the muscles or an abnormality in the blood test, either the liver function or the muscle enzyme. The good news is that this is usually reversible. This can be reversed by stopping the medication.